So let's talk about something really cool. We often hear about smart cities, with smart traffic lights or power grids. But what if a city could use that same tech to manage the health of every single citizen? Well, today we are looking at how one city is doing just that, completely revolutionary. I mean, think about the question for a second. It sounds like something straight out of sci-fi movie, right? Actually, being able to see a public health crisis coming before it hits, giving officials that crucial head to start protect people. But what if I told you it's not science fiction anymore? It's really happening. That's right. The secret ingredient here isn't just a crystal ball. It's data, a massive coordinated effort to collect, analyze, and most importantly, act on health information and city of Solapur. Okay, so let's really get why this such game changer. You have to understand what things were like before, like a lot of growing cities of Solapur was struggling with what you could call huge health blind spot. Just a picture, it every hospital, every clinic, every lab, basically its own little island. Records are buried in dusty manual files. None of this data is being shared, and nobody has single clear picture of what's happening across the city. This kind of fragmentation means by the time you spot a disease outbreak, it's already spreading, and trying to manage crucial resources like hospital beds, it's a total guessing game. And really, this slide sums up the massive shifts that are taking place. It's about moving away from being constantly stuck in crisis mode just by reacting to emergencies as they pop up and moving towards system that's always on, always watching and always looking ahead. It's about getting in front. So what's the solution that makes all this all possible? Well, the best way to think about it, city-wide digital nervous system for healthcare. It's this incredible network that finally connects all those system different parts, letting them to talk each other and share info. And this is the brain behind the whole operation. It is developed by a group called Team Anveshak, and it's called SMC Healthcare System. Now there are two keywords that you have to got remember: integrated and AI enabled. Integrated means connecting, it connects all separate islands, and AI enabled means it doesn't sit on the data, it actually learns from it. So how does this whole thing actually work? Well, it breaks down into pretty simple but super powerful four-step loop. First, it pulls its health data from all across the city, then it brings all that info all that info together in one central hub to analyze it. From there, the AI model actually gets to work predicting that might happen next. So the first major piece of the puzzle is the centralized command center. Seriously, you should picture like it's NASA mission control room, but instead of launching rockets. Now instead of some poor officials having wade through thousands of spreadsheets, they can just look at a single number, the city health score. This one metric boils down everything: disease rates, vaccinations, hospital capacity into an immediate, at a glance snapshot of city's health. You know instantly if these things are heading. And you can zoom it in, right? Take a look at chart like this is a 90-day trend. It lets you see exactly which diseases are flaring up and why they are fading away. If you see typhoid suddenly trending up, this is BAM. You know exactly where to focus your resources and your public awareness campaigns. This is what making decisions based on data. And this, it goes even deeper than that. Officials can pull up heat maps to see which specific neighborhoods are becoming hotspots for a disease. They can track hospital bed availability in real time, which is used for managing emergencies. They can even get automatic alerts. But you know what's seeing what's happening right now is one thing, the most groundbreaking part of the whole system, the real game changer, its ability to predict. I love this quote because just it just nails concept perfectly. A traditional health system like a fire alarm, it only goes off once the building is already on fire. The system is like smoke detector. It picks up on the earliest faintest signs of trouble and sounds the alarm. So what does it look like in real life? Let's walk through on it. On day one, the AI model flags a tiny statistically weird pattern in one neighborhood, something a human would probably miss. By day two, more data is coming in that confirms the trend, and the probability of an outbreak starts to climb. By day three, it crosses critical threshold and automatic alert is blast out directly to health officials, telling them Exactly. Okay, so all this is fantastic for the people in charge, right? But what does it mean for the average person on the street? And this is absolutely crucial. The citizens portal is multilingual by offering everything in local languages like Marathi, Indian, and Kannada, English, right alongside English. The system makes sure technology is helping people, not creating another barrier. Anyone, no matter their background. This system is also proactive for you, the citizen just getting simple helpful text messages, this like no more forgotten appointments, no more missed vaccinations. This direct line of communication is so simple but so effective. And here's where all it comes full circle. Remember that system that detected the rise in typhoid cases on the command center dashboard? Well, now it's sending a targeted alert straight to the phones of citizens in that specific area. So at the end of the day, what's the big takeaway here? It's about all the connections, connecting the dots in the data to see big picture, connecting hospitals so they can work together, and connecting officials directly with the citizens to provide better care and information. It's about building a healthier, safer city. The story of Solapur really gives a powerful blueprint what's possible, and it makes you wonder. All our cities get smarter, and could systems like become new stand? It's a big question, and the answer could be completely change the way we think about the public health forever. Thank you.